Hello, I'm Harvey Godwin Jr., Chairman of the Lumbee Tribe. And today we're at Scotland Healthcare Systems in Laurinburg, North Carolina, which is in Scotland County, which is part of the Lumbee Tribe territory by our Constitution. It's a sad day for us to be here to bring these messages, but this is a continuing effort to promote this shot is your shield. And I'm happy to be here with these 3 Lumbee medical professionals that work here at Scotland Health in Laurinburg to bring you the messages of what they do each and every day for not just our Lumbee people, but all people who come into this facility with COVID complications.
Hi, I'm Dr. Tala Smith-Lowry. I'm a hospitalist physician here at Scotland Memorial. First of all, I want to thank the chairman, thank the tribe for taking an interest in the current state of our hospital system and what we're experiencing. As a hospitalist, my job is to admit patients to the hospital who are sick enough to need hospital care. And so my primary goal is to admit patients, give them adequate treatment, and then hopefully discharge them back home with their families.
Hello, I'm Ellie Lowry, a certified registered nurse anesthetist, or CRNA, and I echo Dr. Smith's statement there. I thank the Chairman Godwin for allowing us this opportunity and for showing interest in what's actually going on inside the healthcare system. My normal job is to provide a safe anesthetic during surgery. If anyone who's had a surgery, I'm one of the people in the room helping take care of you while you are asleep. And we also provide care up in our labor and delivery ward in the form of epidurals.
My name is Jessica Lowry Goins. I am an ICU nurse here at Scotland Memorial. I manage patients at the bedside, help carry out the doctor's orders to get them better to hopefully go home soon.
Today, our goal is really to hopefully give the community some insight as to what's going on during this pandemic. Most hospitals right now are putting out graphs of numbers of COVID patients on a day-to-day basis. And, you know, you'll sometimes or quite often see the numbers of vaccinated versus unvaccinated patients. And I want to say that is in no way to pit folks against each other or to place blame necessarily, but it's really so that we can be transparent for the community and so that we can help you understand why the vaccine is so important. So for our hospital here just today, our numbers currently are 32 patients who are sick enough to be in the hospital with COVID. As far as we can confirm, none of those patients have been vaccinated. Now, we have admitted some patients who've been fully vaccinated before. I think we've had 2 deaths of vaccinated patients, but in comparison, we've had 119 deaths of unvaccinated patients, okay? Now, those are real numbers, and those numbers not only affect us as healthcare providers. You know, this is our job. We're here to take care of patients. We're going to take care of those 32 patients, and that's okay. But it really affects you, it affects our community, it affects our tribe. You know, those 32 patients 2 years ago wouldn't have been here. So on any given day, that means that instead of 60 patients here in the hospital, we now have 90. That means 30 extra patients who need doctors, who need nurses, who need CRNAs, who need respiratory therapists. That's extra staff that most hospitals don't have on short supply. You should care because that excess number of patients, which is happening at all the hospitals across the nation, means that if you get sick and have to come to our emergency department, you're going to have longer wait times. It means that if you're sick enough to need me to admit you to my hospital, I may not have a bed to even put you in or a room upstairs. This morning alone, I had 11 patients in my emergency department who needed rooms upstairs. We didn't have any rooms to put them in. So they've been in the emergency department for 24 hours now, just waiting for rooms to open up. Hospital systems across the state, it means that if Miss Locklear shows up to my emergency department and she, say, needs a neurosurgeon, which I don't have here, it means that when I call UNC Duke, they say to me, hey, Dr. Smith, our hospital's full too. I wish I could take that patient, but I can't. It means that I have patients that I can't adequately take care of because hospital systems are overwhelmed. It should also matter to you because those 32 people could be you, could be your mama, could be your daddy, could be your sister, your brother. And I explain to my patients, COVID comes in kind of like a train, like a runaway train, and we don't know who it's going to kill or who it's just going to cause minor symptoms in. If you're sick enough to see me in the hospital, that means you've got a bad runaway train. And COVID comes in, it ramshacks your lungs, not just one part of them, but all of your lungs. Unfortunately, we don't have a good cure for the damage that it does to your lungs. Now, when you're here in our hospital, we give you the absolute best care we can. We treat you with state-of-the-art medicines that we hope help your lungs. But oftentimes we see these patients get much, much sicker before they get better. And so I tell every patient I admit, listen, you're probably going to get a whole lot worse here no matter what I do. I'm going to do everything I can to save your life, but I don't have a cure for this. I can't fix the damage that COVID has caused. And what I see happen is over the course of days to weeks, patients have worse time breathing. They need more and more oxygen. They're going to be kidney failure. They sometimes need dialysis. Their hearts fail. They need what we call life support medicines. And ultimately, they need some of my extra staff to really step in and help me save their lives. So I'll let Elliot kind of talk more about that.
Just to echo what Dr. Smith was saying, and just to go back to what I had previously said, a normal day for me as a CRNA is being attached to room 1, for example, to provide a safe anesthetic along with my anesthesiologist and surgeon for the surgery that you may be having. Since the pandemic started, the hospital decided that anesthesia would provide the airway support, since we're considered airway experts, for any patient, as she described, who is what we would say is crashing. The disease process has taken over their lungs and they need to help breathing. The oxygen is not enough at that point, so they need to be put on a ventilator, or as I'll say, life support. And what does that mean? That means now, instead of me being able to do what I normally do in room 1, for example, we're called overhead to run up to whatever room is needed. And I'll go up to the head of the bed, we'll push those life-saving drugs, and we'll put you on a ventilator. What does that look like? We don't have a ventilator here, but I do have the device that I use in order to do that. This here blade, if you can see here, is what I have to use to insert through your mouth, lift up, and find the vocal cords. Once I do that, I'll take this here, what we call an ET tube, essentially a straw, that goes through your mouth, in through your vocal cords, and you are then attached to a machine that will breathe for you. That's what's basically keeping you alive. So that sounds kind of grim, and if it does, it's because it is. In the normal OR setting, that's controlled. You're coming in for a surgery that's been planned. I have more control of the room. My colleagues have more control of the room. You're healthy. You've been checked out by your primary care doctor. The anesthesiologist and myself has checked off and says you're healthy enough to have this surgery. If I'm called upstairs, it's almost too late. And we're here today to explain these things to you from what we're seeing, in hopes that we don't see you in that situation.
So to piggyback on what Dr. Smith and Mr. Lowry said, a lot of times our COVID patients come in requiring little to no oxygen, and they quickly progress to where they are dependent upon high concentrations provided by either a mask or a cannula through their nose. Oftentimes, like Elliot said, this leads to intubation quickly because they tend to spiral. Once that happens, the nurse is the primary contact for that patient. Oftentimes, family is not allowed in because we're scared that it'll, spread more in our community. So we're the eyes and ears for that family, also for that doctor a lot of times to keep that patient safe. They require a lot of attention. They can go bad, what we term go bad quickly. Even just the brief removal of their oxygen, sometimes they will spiral fast, requiring quick intervention. Oftentimes too, I personally have had to hold an iPad while a patient is expiring. I've watched loved ones say virtual goodbyes to their loved ones, and it's pretty sad when you think about it, that's what life comes to. You're dying in a room with a practical stranger instead of being surrounded by your loved ones. It's taken a toll on us as nurses we work long hours, we're working extra hours just to make sure your loved ones are cared for. It's mentally exhausting, it's physically tiring, and most of all, it's emotionally draining. We often try to, not get so involved, try to leave the emotional aspect out of it, but it's hard to do. It's hard to do. There's still people, and there's a different kind of fear in their eyes versus other patients that we care for. So I'm just here to encourage you to do all that you can to protect your family, to protect our community, and take the vaccine just to help you. That way you don't have any regrets later.
I hope that what we've said here today has been helpful for you to know what we're experiencing here in our hospital. The take-home message is that there absolutely is hope, okay? The 32 patients I have here today, I'm very hopeful that a month from now, that number will have dwindled down to 5, and then to 2, and then ultimately to 0, okay? The best way we can keep you out of this hospital is by your body having what it needs to fight off COVID, and those are antibodies. There are 2 ways to get antibodies. The very best way is through vaccination. That's where you take a shot of a vaccine, your body develops antibodies so that when it comes in contact with COVID, it's kind of like a Pac-Man, that antibody is, and it eats the virus, it fights off the virus. It keeps the virus from being able to do the destruction to your lungs. The second way I can get antibodies in you is through an outpatient antibody infusion. So say you test positive for COVID today, if you meet certain criteria, and the criteria are hard to meet, you qualify for an antibody infusion. The reason that's not as good as the vaccine is because by the time most people know they have COVID, the virus has had about a week to already do some damage. So the vaccine decreases your chance of being in the hospital by 90%. The infusion does it by about 70%. I want you to have antibodies. The best way to get them in is through the vaccine. Now, I've had some people say, hey, Dr. Smith, are there ways I can boost my own immune system? Well, there are. We've got a lot of folks taking vitamins, vitamin D, zinc, those are great. We want you as healthy as possible. That's pre-COVID, that's after COVID all the time. We want your vitamin levels up, we want you healthy. But I tell my cancer patients to take vitamins and to stay healthy, but they're also still getting their chemo, okay? I tell my diabetics to do that, but they're also still taking their insulin. So it's not a substitute for the vaccine. There's also been a lot of conversation about a medicine, ivermectin, that is specifically an anti-parasitic medicine. It's FDA approved to treat parasites, which are worms. We don't take it a lot in America because fortunately we have clean water supplies and we don't need it. We give it to our animals because our animals more commonly have parasitic infections. I'll say that there's no good study showing that it works against COVID. Again, it's an anti-parasite, it's not an antivirus medicine. Here at Scotland, we pride ourselves in giving the gold standard of medical treatment for COVID. I do that by talking to specialists on a weekly basis, okay? And I have this past week talked to doctors at CMC Maine in Charlotte, at UNC at Duke. Every time I talk to them, I say, hey, are you guys doing anything different? Is there any new medicine? Is there any new way to treat this? And I can guarantee you, you're getting the gold standard here, and ivermectin is not a part of that. Personally, I was vaccinated as soon as it became available. Part of that's because I'm fortunate to be able to read the data, to know the data. I was trained to do that. I knew it was my best option. I'm going to have a baby soon, and I knew it was the safest way for me to have a safe pregnancy and to keep myself, my 2-year-old at home who can't be vaccinated, safe. I lost a lot of patients last year before the vaccine was available, and they had no options. They didn't have any chance to not end up in my hospital and to not die. So I took it for them. We have a great opportunity. We've been blessed with a vaccine that's safe and that's effective, and I would just strongly encourage you to consider taking it.
Just take a couple of steps back from an operating room standpoint. When you hear in the community terms like elective surgeries being canceled or being on diversion, what does that mean for you? If you have elective surgeries being canceled, that means things that we deem that are not life-threatening will be postponed. So maybe you need your knee replaced or that shoulder done. If numbers continue to rise and we continue to go down a road to where we don't have beds, then we won't be able to do some of the surgeries that may require you to stay overnight. So you will be delayed. We haven't got there yet. And one of the reasons we're doing this video is to help us not get there. From an anesthesia perspective, again, I'll echo what Dr. Smith says. If whatever treatment that you are taking at home from your local provider, make sure it's just that, a local provider. We don't want to make our jobs tougher by treating patients who are coming in taking medications that wasn't supposed to be for human use. So help us out in that regard. Why did I get vaccinated? I go back to this too. This is what I do for a living. I didn't want to be in a situation where my wife, children, parents had to come see me with this sticking out of my mouth. So that's my message to you guys. Don't be up here in our hospital with a tube sticking out of your mouth. Take the vaccine. Tell your friends to take the vaccine. Wash your hands. Wear a mask. And let's use, I'll say, common sense that the good Lord gave us. And I say good Lord because our community prides itself on walking with the Lord. The Lord gave us the knowledge to read the data, understand the science. Let's use that. Lean on God, but lean on science as well. Because, in my opinion, God gave these scientists, these doctors, these nurses, these anesthesia providers, the wherewithal to be able to help you once you came in. Let's, help us, help you. How can you do that again? Vaccine, wear a mask, wash your hands.
So my reasons for taking the vaccine were twofold. The first is I've worked as an ICU nurse since the start of this pandemic, so going on 2 years now. I've seen a lot. I've seen a lot of patients be critically ill. I've seen a lot of patients not leave the ICU. And if you're one of the ones that was fortunate enough to, you didn't leave without permanent damage to your vital organs. I didn't want that to be me, but most of all, I didn't want it to be any of my family members. I was terrified that I was going to bring something from work home to my family. So when the chance came to be vaccinated, I jumped at it. The second thing I would echo too, if you're not going to get vaccinated, to please social distance. Our community is made up of a lot of large families. We've had to make an adjustment. My family doesn't get together, whereas before COVID, that was something we did every Sunday. So maybe one day we'll be able to get back to some normalcy. So definitely social distance, wash your hands, wear your mask if you're not going to take the plunge and be vaccinated, which is the best option.
This shot is your shield.